Dear colleagues, I am announcing a technical break. We are waiting for one more member of the Dissertation Council who hasn't joined the conference yet. Dear colleagues, the technical break is over. We're starting our work. Dear colleagues, good afternoon, members of the Station Council, and also colleagues who are watching our broadcast. Let me start the Station Council session. It's dedicated to the defense of the station by Belozer and Sergeevna seeking an academic degree of academic candidate of psychological sciences and the degree field 19 or medical psychology on the topic relationship between cognitive and affective disorders.
Отлично слышно, да.
Can you hear me? Реги, я не уверен, что Марк слышит нас. Okay. I'm and in the presence of Olga Yurievna Sholkova, Doctor of Psychological Sciences, Professor, acting head of the Department of Medical Psychology and Psychophysiology of St. Petersburg State University, is the chairperson of this dissertation council, and who, according to the Act of St. Petersburg University of 2nd April 2020, the following membership of the dissertation council is established: Valentina Anatolyevich Babkov, Doctor of Medical Sciences, Professor at Department of Medical Psychology and Psychophysiology, St. Petersburg. Can you hear us? Yes. Anna Vladimirovna Vasilova, Doctor of Medical Sciences, Chief Medical Research Fellow of the Department of Borderline Mental Disorders and Psychotherapy of National Medical Research Institute, Center of Psychiatry and Neurology named after Becker. Yes. Mikhail Mikhailovich Reshetnikov, Doctor of Psychological Science, Professor, Rector of the Eastern European Institute of Psychology, Psychoanalysis, yes. Mr. Mark Hopkins Bickert, PhD Professor of Lehigh University of St. Petersburg. Can you hear us, Mark?
Yes.
Yes, and also the defendant, Anna Sergeyevna Belozer. Can you hear us? Can you see us? Yes. Yes, can you hear? Yes, I can hear. Also online with us is the academic advisor of the dissertation, author, the professor of the and the head of the Department of Psychiatry and Narcology, St. Petersburg University. Can you hear us? Yes, I can. Petrova Natalia Nikolaevna. And also, everybody is online. Everybody, we can see and hear each other. Colleagues, since our session is in an online mode, according to the above mentioned Act of St. Petersburg University, uh, dated 23/03/2020, I would like everybody, uh, all members of the dissertation council, follow the procedure, and if there's any technical disruption, please, you cannot hear or see someone, please let me know, and I will declare a technical break to fix the disorders. If there's a break connection with me, then would like to ask Valentina Antonovna Babkov to make an announcement about a technical break. Valentina Antonovna, do you agree? Yes. Uh, Members of the station, do you have any objections? No. Uh, uh, let's To improve the quality of connection. Please switch off the mobile phone. To switch off your microphones when you're just listening, but don't forget to switch them on when you are given the floor. Also, an audio recording is taking place. And the video recording is taking place of the session, and also there's a simultaneous interpretation from Russian to English and vice versa, also broadcast online on the site of the St. Petersburg University. Uh, on the page of the defendant, there's an email address where you can send your questions, and they will be forwarded. All these questions will be forwarded to me. Well, all questions will be forwarded only that deal with the dissertation and the presentation of the dissertation, and those that have a full signature with affiliation, name, etc. of the sender. And please, questions that have no relation to the discussion uh, will not be read. In accordance to the regulations covering in St. Petersburg University guaranteeing the awarding of degrees of candidate of sciences and also doctor of sciences, different bylaws. A dissertation council session is legitimate if not less than two-thirds of the established dissertation membership is present, but not fewer than four people. Our dissertation council consists of five people. Everybody is present. All of them are online, and everybody has an audio and visual contact with, so the quorum is there. And I would like to delegate to the curator of the defense, the specialist of the Office for Dissertation Council Support, Larissa Victor Khrushcheva, to start attendance list in which she should mention all members of the state council, and this is the agenda of today's session. The session will not last more than 2 hours. It will consist of a short presentation of the chairperson about the paperwork that has been submitted by the defendant, about 5 minutes. Short presentation of the author of the dissertation that covered the key issues of the research. About 15 minutes questions to the defendant, strictly on the presentation of not more than 2 minutes per question. Answers of the defendant not more than 5 minutes for all questions. Then there will be reviews of every member of the dissertation council and with questions and recommendations, about 10 minutes per speaker. Then there will be a presentation of the review of the chairperson with their evaluation, 10 minutes. Then answers of the dissertation author uh, to the questions, not more than 5 minutes. Then there will be um, there will be a time when the chairperson will read out the questions that have been submitted via an email on the website, and also there will be answers of the defendant, not more than 2 minutes per question. Then academic advisor will speak with their statement for 3 minutes. Then there will be deliberation of the dissertation council members before an open voting procedure, during which the broadcast will be switched off. 5 minutes. There will be an open voting procedure and the counting of votes by the dissertation council chairperson, entering the results into the minutes. Then a decision will be taken to award or not to award a sought academic degree, and then a concluding statement of the defendant of not more than 2 minutes. And this will be the end of our session. Dear colleagues, do you have any questions or objections regarding this procedure? Thank you very much. No objections. Then we'll start with the first item. I would like to give the floor now to the academic advisor of the dissertation, of the candidate, Doctor of Medical Sciences, Professor, Head of the Department of Psychiatry and Narcology of St. Petersburg University. The dissertation was written during St. Petersburg University until then you will be given the floor. Uh, a short presentation by the chairperson. The dissertation of Anna Sergeevna Belozer, seeking an academic degree of Candidate of Psychological Sciences in the academic degree field 1904 medical psychology, on the topic of relation between cognitive and affective disorders in ovarian cancer patients, was accepted for defense by the act of the Academic Secretary of St. Petersburg University on the 27th of March 2020. Belozer and Sergeevna wrote her dissertation in St. Petersburg University and under the supervision of Natalia Nikolaevna Petrova, the head of the Department of Psychiatry and Narcology of St. Petersburg University. The number of publications of the defendant in which key issues of the results of the dissertation are presented include 9 works in refereed journals from the list of the Ministry of of Education and Science of Russian Federation, 6 publications, and then in the Scopus and Web of Science publications, two publications. The defendant has presented the academic century a full package of documents in order to be accepted for defense. All documents comply with the requirements and are stored in the file of the defendant, and the copies are with the member of the Department of the Support of the Station Council work, the curator of today's session, Larissa Viktorovna Khrushcheva, who is online with us. And before I give the floor to the defendant, dear members of the Station Council, I would like to, well, I must ask you a question. Do you have any general questions to the defendant? Do we have any need to list the paperwork or no need to do that. No need. Thank you very much. Well, then I would like to give the floor for the short presentation to the defendant, Anna Sergeevna Belozer. Anna Sergeevna, 15 minutes. Well, please start your. Thank you very much. Can I start the screening of my presentation? I would like to interrupt you in order to ask dear members of this session, can you see the presentation on the screen? Yes. Anna Sergeevna, please, your report. Dear members of the Dissertation Committee, I'm pleased to present for your attention the thesis completed on the subject of relationship between cognitive and affective disorders in ovarian cancer patients. Ovarian cancer is a serious life-threatening disease and occupies a significant place in the structure of cancer of the female population of Russia. Literature analysis demonstrates that women suffering from gynecological cancer experience affective and cognitive disorders at all stages of the disease. However, there's also literature review dedicated to the structure of affective and cognitive disorders in ovarian cancer patients demonstrate inconsistency and varied according to the research methodology. Most of the studies dedicated to the cognitive impairment have been conducted for the breast cancer patients. Up to date, cognitive functioning in ovarian cancer women remains insufficiently examined, and the effect of anxiety or depression on the cognitive functions is not quite clear. Research object, specifics of cognitive function and psycho-emotional status of women with the histologically confirmed diagnosis of ovarian cancer. Research subject, cognitive functions, verbal memory, working memory, motor speed of information processing, attention, executive functions, and psycho-emotional status, anxiety and depression, relationship between psychological and clinical parameters, social and democratic characteristics, quality of life, degree of hostility and aggression, attitude to the disease in women with ovarian cancer. The purpose of the study was to examine cognitive functions and affective disorders, psychopathological symptoms, anxiety and depression in women with ovarian cancer. The following goals have been established: to estimate prevalence, structure, and possible predictors of cognitive disorders in ovarian cancer patients, to estimate prevalence, structure, severity, and predictions of anxiety and depression of ovarian cancer patients, to evaluate relationship between cognitive functions and anxiety and depression in ovarian cancer patients, to study the quality of life, attitude to the disease, and the degree of hostility and aggression in ovarian cancer patients, to estimate the relation between cognitive function, anxiety, depression, and the quality of life to the disease, hostility, and aggression, describe the relation between psychological and clinical parameters in ovarian cancer patients. According to the results obtained, the following scientific statements are presented for the defense. Cognitive disorders in ovarian cancer patients have significant prevalence and affect a wide range of cognitive domains. The complexity of the heterogeneous structure of cognitive disorders in ovarian cancer patients is associated with social-demographic, somatic, and psychological factors, while there is no significant association between combined treatment, including chemotherapy, and the cognitive functioning of ovarian cancer women. Second, in patients with ovarian cancer, affective disorders have a wide prevalence and are represented mainly by depression, anxiety, as well as their combination, 50%. The most common are signs of depression, 18.3%, in structure of which symptoms of asthenia and anxiety predominate. Somatized variants of depression are also presented. The manifestation of anxiety have mainly psychogenic character. Younger women under 50 years are more vulnerable to anxiety and depression than older women. Three, there is a significant relation between affective and cognitive disorders. There's a mediated relation between the parameters of cognitive functioning and severity of somatic condition in the women with ovarian cancer. Depression and anxiety mediate the influence of somatic condition and cognitive functioning. Women with ovarian cancer have lower quality of life compared with the healthy controls. They have a higher degree of guilt and indirect aggression. The most common type of attitude to the disease is the ergopathetic, escape to work, harmonious and secretive types of attitude to disease are present as well. Depression and anxiety identified in ovarian cancer patients negatively correlate with their satisfaction in all spheres of quality of life, physical, moral, social, and functioning, and with their general health status. Identified the cognitive dysfunctions have relationship with ineffective emotional regulation, increased degree of hostility and aggression, as well as with the presence of non-adaptive types of attitude to disease. The assessment of patients, including clinical, anamnestic, and experimental psychological research methods, cognitive functioning has been evaluated by means of the PACS battery, which was standardized for the Russian population, the hospital anxiety and depression scale and Montgomery-Åsberg depression rating scale were used for the assessment of anxiety and depression. Both methods are the ones most frequently used in the modern studies for the assessment of ovarian cancer. The size of smear sample has been supported by mathematical justification. Results obtained have been analyzed and with a wide range of mathematical and statistical methods presented on this slide. Method of structural equations enhances originality of this thesis. Analysis of structural equations allowed to analyze heterogeneous influence to reveal effects. Most of the women examined have had a higher education or one or more children. Half of them were married. They continued to work during the assessment period. This slide, ovarian cancer diagnosis has been histologically confirmed for all women enrolled. More than 20 clinical parameters suspected to be potentially responsible for cognitive function and mental status of the patients were analyzed, including chemo treatment, hormonal status, previous surgeries, and disease complications. The number of days since hysterectomy was considered. According to the screening assessment of the hospital scale, 12% of women had symptoms of depression and 19.5% had the symptoms of anxiety. A significant number of patients, as 13.4% had a subclinical level of anxiety. Anxiety is high among younger women. comorbidity of anxiety and depression was equal to 50%. The results of the comparison with the population of healthy Russian women suggest that depressive disorders are prevalent among ovarian cancer women. According to the Montgomery-Asberg Depression Rating Scale, the rate of depression in the examined group was 18%. It's worth noting that mild forms of depression were predominant. Age should be considered as a predictor of affective disorders in the group of ovarian cancer patients. Women under 50 years old are more vulnerable for the onset of depression. Two clusters of symptoms have been identified in the structure of depression in the ovarian cancer women. The asthenic cluster formed by hypothymia and asthenia, and the cluster of anxiety determined by internal tension, sleep disorders, attention impairment. Clinical socio-democratic characteristics of somatic complaints were analyzed as potential predictors, and depression has been identified that depression in ovarian cancer can be described by two types of models. The first model describes a somatized version of depression and is formed by asthenia, sleep disorders, diarrhea, and constipation. The second model describes somatogenic depression, where anemia plays a decisive role. Regression analysis did not reveal any significant clinical predictors of anxiety. Negative thinking associated with anxiety, the manifestation of anxiety are predominantly psychogenic. Cognitive domains in the assessed group of ovarian cancer women were selected based on the recommendations of the International Cognition and Cancer Task Force for patients with non-CNS tumors, namely verbal memory, working memory, motor skills, speed of information process, attention, executive functions. It is identified that the cognitive profile of the ovarian cancer patients does not differ from the healthy population and the mean values. Nevertheless, a significant prevalence of cognitive disorders has been detected in the ovarian cancer patients with a wide range of the mains affected. The most prevalent are the speed of information processing and motor skills impairments. Executive functions are noticeably less frequently impaired. The women frequently complained about cognitive impairments in memory and attention domains. However, there are no significant relationship between self-assessment of cognitive functions and the objective neurophysiological assessment. Self-assessment does not reflect an objective cognitive impairment in ovarian cancer women, which proves that independent neurophysiological assessment is required. Comparison of 5 age-based groups of ovarian cancer women with the normative data for each group did not reveal significant relationships between the history of chemotherapy treatment and cognitive impairment. Linear regression analysis showed that a disease complication such as sarcoidomatosis predicts impairment of the working memory domain and the stage of disease, the speed of information processing. The joint model education and age determines the efficient functioning in the domains of attention and executive functions. The study examined the relationship between cognitive, affective, and somatic characteristics of the ovarian cancer patients. The confirmatory factor analysis was performed as the first step of the analysis. Parameters included in each factor are presented in the slide. In order to clarify the structure of the relationships of the selected factors, further analysis was carried out by the method of structural equations. Basic and alternative models have been analyzed. The first figure in the slide shows that there's no direct somatic influence on cognitive parameters. The somatic factor is indirectly correlated with anxiety and depression. There's an association between affective and cognitive factors. Since the direct effect of the somatic factor is not significant, but there is an indirect significant effect of somatic affective and somatovegetative complaints, it can be assumed that the affective factor mediates the influence of somatic disorders on cognitive functioning. Anxiety and depression can be caused by the severity of the somatic condition. The second figure shows that if vegetative complaints are excluded for the model, the effect of mediation disappears. Ovarian cancer patients have higher rates of indirect aggression and guilt. It has been shown that hostility and aggression of women are significantly related to anxiety and depression. The data received proves that anxiety plays an important role in aggressive and autoregressive behavior, while depression is associated with hostility. Regression models demonstrate that impairment in working memory and simultaneous improvement in verbal fields are associated with the open forms of aggression. The regression model completed to assess the contribution of affective disorders in quality of life in ovarian cancer patients demonstrates that the overall satisfaction of patients with their well-being is largely determined by anxiety and depression. However, if the decline in physical role and social functioning is determined by depression, anxiety determines satisfaction with emotional functioning. In the structure of the internal perception of the disease in ovarian cancer patient, the ergopathetic, harmonious, and sensitive types of attitude to the disease are more pronounced. In ovarian cancer patients, the most common types of attitude to the disease are of the first block. If affective disorders are not present, the women were able to demonstrate adaptive responses to their disease. Affective disorders could be a reason to choose the responses with intrapsychic orientation. It is specific for ovarian cancer patients with anxiety to demonstrate not only intrapsychic but interpsychic types of personal responses as well as with the pronounced dysphoric component. The results of the study of the relation between the types of attitude to disease and cognitive convenience showed the presence of significant relationships. Thus, the obtained results confirmed that patients with a higher level of cognitive functioning, the domains of executive functioning and attention, are distinguished by a more harmonious attitude to disease. Dear members of the Dissertation Council, the main results of the study are presented in the text and the dissertation and on the slides. Let me please not read them out. I thank you for your attention. Olga Yurievna, please switch on your microphone. I switched on my. I would like to ask Anna Sergeevna to switch off the demonstration of the screen. Thank you very much. Dear colleagues, we are continuing. Any questions to the presenter in relation to the content or to the presentation? I have one psychological question. In your presentation, you had a table in which arrows demonstrated the relationship of affective and cognitive components, and that you can understand that cognitive functions depend on affective condition. Is this true, or do you think that is not correct? This is our eternal question: what is primary, what is secondary? For all, we have not more than 2 minutes for your answer. Thank you very much for your answer. As I understand that you mean the slide where the model of the interrelationship between the affective and cognitive factors. Yes. Let me clarify what I meant. There's a presence of affective factor on the semantic factor, but this influence, the affective factor mediates the semantic factor. This is a question of the interrelation between the affective and cognitive factors. In our study, we didn't find any direct relationships. We just thought that this was a mediator factor. Dear colleagues, do you have any other questions? If you don't have any questions, then we continue our work. And now members of the Dissertation Council have the floor to read their reviews. Valentin Anatolyevich Abakov, please. But before that, I would like to say that there are no internal reviews, so therefore would like to, and after just the members of the State Council reviews, and then Anna Sergeevna will answer questions that are contained in all the reviews of the Station Council members. You can read the whole review or just the key points of your review, because all the reviews have been uploaded onto the website, and there's any need to read the whole. Dear Anna Sergeyevna, the relevance of your topic is in the spread in our country of ovarian cancer in women, and also the difficulties of treatment and the rehabilitation of patients with this pathology, including because of the understudied character of the role of psychological factors in this process, the evaluation of the justification of your statements and conclusions. The it's just justificate justify and um, because and the statistics the results of the author and the wording is very logical. the work that her work is practically significant, and the validity of the research results, I think, is there. It's based on the different types of uh, patients, 82 patients in all, and the use of up-to-date modern theoretical apparatus, valid psychodiagnostical instruments. The results allow the author to identify the most promising avenues of psychological research in this very complicated category of patients. On the whole, the results of the work will help plan and optimize the process of psychological diagnostics and clarify the role of psychological factors and the understanding, treatment, and the rehabilitation of patients. The materials of dissertation prove that the dissertation author did an original research and methodological concepts have been developed on which the experimental part rests, and the algorithm was identified, and the practical recommendation now. The number of publications is sufficient. Dissertation is illustrated with figures and has an appendix. The English translation reflects well the work in Russian. The methods are adequate to the research. The main statements for defense of the dissertation are well argued and valid. The 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 publications that have been published that reflect everything. Well, my questions. The psychotherapy, the the questions are the application psychotherapy served as a criteria of exclusion. What's the explanation? Do we need psychotherapy for this group of patients? The research data show well, there will be two questions, but the first question, as I said, the application of psychotherapy served as the criteria of exclusion. Why, and do we need psychotherapy for this patients? And the second, I didn't find the answer to my second question. The second question, obtained data show a low level relative to the total population of depression. How can you explain that 43.9% of recurred patients and 33.6% of metastasis? And my conclusion, the dissertation of Anna Sergeevna Belozer on the topic of relationship between cognitive and affective disorders in ovarian cancer patients uh, uh, meets the main requirements set by the Act of St. Petersburg University on the awarding of academic degrees, and Zorova Anna Sergeevna fully deserves the awarding of academic degree of candidate of psychological sciences and the degree field 1904 medical psychology. This is the end of my presentation. Olga Yurgivna. And now my microphone is Valentin Anatolich. Thank you very much for your presentation. The questions will be answered by Anna Sergeevna after all the members of the State Council have read their reviews. Now I'd like to give the floor to Anna Vladimirovna Vasilyeva. Please, Anna Vladimirovna. Thank you very much, and Olga Leonidovna. Can you hear me? Then now I'd like to the high frequency and the successes in the effectiveness of treatment over the last decade, and widely varied level of severity and death rate of tumors. Cancer tumors determines the speed of the development of such interdisciplinary field as oncopsychology, with extensive growth of research that are dedicated to psychological aspects of biopsychological models of in cancer treatment. The comprehensive study of the relation of emotional disorders, cognitive representations of the disorders, and the cognitive functions have received variants in somatic medicine and in the first in psychocardiology, and this in such field as the one that covers tumor disorders, and now this research is limited to oncohematology, which then is another reason for us to see that say that the dissertation is very valid and relevant, and this research is dedicated to the identifying of the interrelation between cognitive and affective disorders in ovarian cancer patients, and the analysis of literature of epidemiological data signifies that the ovarian cancer is a very common disease, and it causes death in a great number of women, including younger women, and therefore it leads to depression in these patients, and this we have to take into account that because of the toxic effects of tumors on the organism. Asthenic syndrome is one of the key with oncological diseases, and therefore this work is very relevant because it can go a long way to serve as a planning tool for individually customized psychological support for this person. The author used a very correct method of statistical treatment, which led to the achievement of the goals, and this is very is not very typical of psychological works. The affective the author experimentally proved that the cognitive impairments cover a great field of the quality of life. A multi-level, and new experimental data has been a detailed description of key components of ovarian cancer disorders. The structure, this dissertation covers both different ages. The author completed original mathematical modeling, and that talks about the high quality of this research, and a great contribution is the relationship of the satisfaction factor. The instruments well, the instruments are developed to facilitate the compatibility between the research conducted in Russia and the research conducted in foreign countries, and the theoretical part. The structure of the dissertation includes the following parts. The theoretical part that reviews the academic literature of cognitive functioning and affective disorders in patients with tumors, ovarian cancer. Methodological justification of the research, experimental part that that contains the empirical material treatment, the results, and the discussion, and the conclusions, the practical recommendations. There's a list of acronyms and other legend map symbols and the literature, and one sub-appendix. The dissertation includes all necessary sections, and it is 166 pages long, has 41 tables and 6 drawings, figures. The list of literature includes 214 sources, both Russian and foreign sources. the when we evaluate the results, we can say that the harmonious type of internal picture of the disease, as it was shown in other Russian studies, and this field determines the absence of emotional disorders, and not vice versa, as the author stipulates. Also, there's no strict delineation of terms of neurotic, nosogenic, somatized, and somatogenic fields, and this makes it difficult to read and take in the content. But all these comments and criticism don't diminish the value of the work. As part of the discussion, I would like to receive answers to these questions. When we talk about the so-called contamination of data, when we deal with mental disorders and semantic practices, could the author clarify how to, in the group of patients with pangysterectomy, the differential diagnostics was conducted between somatovegetative manifestations of psychopathological disorders and the clinical manifestations of the post-castration syndrome, which is manifested in the by vegetative disorders. And the second one is when we see that the pressure on the patients is equal, what is the advantage of using in the practice of clinical psychologist of psychometric methods over the psychodiagnostic methods. But the conclusion is that the work was conducted on a very relevant and understudied topic. The results of this session can be used by clinical psychologists and other specialists working in the area of oncology. And also, I would like to say that the volume of the work and the time consuming character of the work and the high quality of the work and the diversity of used methods are very commendable. And therefore, I would like to say that Anna Sergeevna Belozer deserves to be awarded the third degree. Mikhail Mikhailovich Shetnikov, your review. Dear Olga Yurievna, dear Natalenka, dear Anna Sergeevna Belozer, dear colleagues, after such a detailed study of the work by the previous colleagues, it's hard to add anything, and therefore I don't see any importance in reading this, because it's my review is on the website, and therefore I will jump to my criticism. And well, first of all, I would like to say that the work is very commendable, but I have some questions and recommendations. In statement number 7, the for defense, the author says that the cognitive disorders are related to ineffective regulations, the ineffective regulation of affect, and also with the presence of disadaptive types of attitude to the disease, paranoia and dysphoric, while the parameters of working memory, melancholic and apathic types, and also in for apathic types, the decrease in the levels of executive functions. But the term executive functions is not defined very well in the work. The second one is the ovarian cancer is in fact disabling condition for any woman, and the author practically doesn't cover this aspect. I would like to see this clarified, and especially from the point of view of a woman having or not having children. And therefore, nevertheless, my conclusion is that Anna Sergeevna Belozer deserves the awarding of an academic degree of Candidate of Psychological Cancers in the degree field 1905-04 medical psychology. Dear Mikhail Mikhailovich, now I would like to go to Dr. Dr. Mark H. Bickard, Hopkins Bickard. Please, colleague, can you hear us? This is your turn to...
Okay, yes. So I should start?
Можно ли начинать?
I will just have a few things. This is a major study investigating the prevalences of and relationships among cognitive and affective disorders among ovarian cancer patients carried out in St. Petersburg, Russia. It also explores several additional factors that could affect patients' quality of life. And then I have a list that I will not read. It's quite an impressive list of results. And I do have a question actually there. I don't know when the appropriate time to ask it is, but I'll just mention it right now. I'm just wondering what Anna's judgment is about what she thinks the most interesting and important results are there. And then this review ends with, this is a well-implemented substantial study with important results. I strongly recommend it as satisfying the requirements for a PhD dissertation.
Заканчивается тем, что я рекомендую для присуждения степени автора этого диссертационного исследования. Dear colleague, is the review over?
Yes.
Dear professor.
Yes, I didn't read the list. It's quite a long list, so it would have been a lot longer if I had read the list.
Dear colleague, thank you very much. I would like to read my review, please. The relevance is covered in my review, and where I talk about high mortality levels and the somatogenic and psychogenic influence of cancer on the psychological and mental condition and the behavioral and social adaptation of patients. And at the same time, the number of research studies that would expand the theoretical views of psychological factors that lead or or prevent the psychological adaptation of women with cancer of reproductive sphere is limited. The results of the Russian and foreign research shows that the psychological adaptation to the disease is determined not only by the objective severity of the disease, but with the subjective evaluation of the disease and connected to it by the conditions of life of a particular patient. In this respect, the significance of the dissertation work is very important because it's this work of reacting, the patients reacting to her disease is very important because this is a reproductive sphere, and this is accompanied by the anxiety to lose femininity and endocrine disorders. And therefore, the combination, the cognitive and affective components, and integrated unity, and with the psychological aspects of oncological pathology is original and unique. The work had a general goal of studying the specific cognitive functioning and affective disorders of anxiety and depression in women with the diagnosis of ovarian cancer, and also the assessment of the relation between them. And for this to achieve this work, to this goal, 5 tasks have been formulated, and they have been successfully fulfilled. And the methodological apparatus was identified, and all that led to a comprehensive study of the and the main parameters of the quality of life and the types of attitude to the disease in 82 patients with ovarian cancer were parts of this study, which is very important. Important that psychodiagnostic complex complied with the main requirements of the psychological research and clinical studies, and had the normative data also based both on the Russian empirical data, but also on the international data, which allowed the author to juxtapose the results of their research with the research results of foreign authors. And so she studied different groups of patients: international operative group of cognitive functions and ecology, and the group of the assessment of quality of life of the European Organization of Cancer Treatment and Research. And the author has conducted a very thorough clinical and anamnestic analysis and analysis of social democratic characteristics of patients and chemotherapy results as well. So the validity of the results is undoubted, and I would like to add about say about a few words about the novelty and the theoretical significance of this station. This is reflected in both the theoretical and the empirical parts of the station on the basis of the analysis of contemporary research in Russian and foreign literature. Uh, for the first time, in the research literature, a theoretical review of the cognitive activity and the disorders of affective sphere in cancer patients was shown to be conditioned by psychosocial factors, and also a review of the results of neurovisual research of the brain activity in this pathology was also discussed. It's very important to a new psychodiagnostic complex was used to conduct a comprehensive assessment of the cognitive activity and the quality of life in cancer patients, and especially the use of specialized module for the assessment of quality of life in ovarian cancer patients has been used in Russia for the first time. So then that's very important for pharmaceutical sphere as well. Well, all these things have been reflected in the other reviews. In general, the work is conducted at a very high level, and new contribution to science is evident. Therefore, the work is very significant, both for medical psychology. I have no conceptual questions, but or objections, but just a few questions. The first one: how did you reveal in cancer in ovarian cancer patients the cognitive disorders, verbal memory, operative memory, operation memory, and the speed of information processing in motor and the executive? How do they affect the behavior of patients during a treatment, commitment to treatment, the evaluation of the expected results of the treatment, etc. The second one is the work statistically proves the relation between the cognitive dysfunction with a large spectrum of demographic and amnestic and affective and somatic characteristics of women with ovarian cancer, but also the lack of such a connection with the effects of chemotherapy. Do we see that this empirical result can be explained or conceptually, or is it exclusively statistical, has a statistical or probabilistic character? And because can we expect that such a relationship will be found if the number of patients will be higher after the AXT course. The third one is the clinical examples could be a good contribution to illustrating the results of the research. But on the whole, the work is very thorough, and I totally endorse the resolution of awarding Anna Sergeevna Belozer a third degree of candidate of psychological sciences in the specialism 1900-04 medical psychology, and the item 11 of the procedure of awarding degrees is not violated. Dear Anna Sergeyevna, how we agreed before that, I would like you to answer all the questions of all the members of the Station Council. And please pause after each answering each review. I would like to start with the dear Valentina Anatolyevich, regarding your first question regarding psychotherapy as a criterion of exclusion. The introduction of this exclusion criterion was caused by the desire to avoid data pollution. The study did not include patients whose mental state could be changed due to psychotherapeutic intervention. A preliminary analysis of this led to the conclusion that psychotherapy has a significant effect on the mental stage of patients with ovarian cancer. Research results suggest that supportive psychotherapy reduces anxiety, depression, and improves overall satisfaction with the quality of life. The results of randomized controlled trials for gynecological cancer patients, for example, the work of Peterson and all 22, demonstrate a significant reduction in the severity of psychopathological symptoms as a result of psychotherapy. The effectiveness of psychotherapy for cancer patients was analyzed in the works of Russian clinical psychologists at St. Petersburg University and the St. Petersburg Psychoneurological Research Institute, named after Vector. An example is the work of Ekaterina Pavlovna Lukoshkina, carried out under the direction of Anna Vladimirovna Vasilova. As applied specifically to patients with ovarian cancer, one can distinguish the work of Arden Close, which describes the positive effect of integrative methods of psychotherapy. Regarding your second questions about the relation between depression, recurrence, metastatic process, the study found that the prevalence of depression in the study group was 18.3%, while in a healthy population, 5.7% in St. Petersburg. No statistically significant relationships between depression and the recurrent nature of the course of the disease or the presence of metastasis were found. Recurrent course was associated with the number of courses and lines of chemotherapy, metastasis with the stage of the disease, ascites, pleurisy, asthenia, anemia, and weight loss. This observation is consistent with other researchers such as Ho, J.H., and co-authors who believe that when determining the causes of distress in patients with ovarian cancer, it is necessary to consider not isolated symptoms, but their clusters. Therefore, we can talk about that only when we look at the whole clusters can we achieve any any valid conclusions. These are all my answers to Valentin Anatolovich. I am satisfied with your answers. Thank you. Thank you. Now I would like to turn to Anna Vladimirovna Vasilieva. Dear Anna Vladimirovna, the first question, data pollution. My clarification is this. The exclusion criterion was used in the work. The presence of another acute or chronic somatic disease in the stage of decompensation, which in the opinion of attending physician significantly affects everyday activity and mental state. Accordingly, the patients included in the study did not have a diagnosis of post-castration syndrome. This diagnosis, in accordance with the 2011 National Gynecology Guide, is established on the basis of complaints from patients, the results of a physical examination, laboratory instrumental studies, and an obstetric and gynecologic history. Differential diagnosis between the mental manifestations of post-castration syndrome and the onset of exacerbation or the exacerbation of an abandonment disorder are not in the competence of a clinical psychologist. The work was based on a modern multi-factor model that explains the causes of anxiety and depression through the summarizing effect of biological, mental, psychological, and social factors. And all clinical indicators were analyzed as possible predictors of somatogenic type of depression formation. The volume of surgery, and the number of the types of surgery were included in addition to panhysterectomy, for example, ovariosterectomy, as well as number of days from the moment of performing the panhysterectomy were taken into account. None of these indicators made a statistically significant contribution to the regression model, with the exception of anemia. In this work, depression was studied as an affective disorder, but not as a syndrome within the framework of gynecological disease. A second question: the use of psychometric methods allows the clinical psychologist to achieve standardization of the procedure for conducting research and data processing. In our study, the emphasis was on psychometric methods, since on the one hand, we relied on existing recommendations, and on the other hand, we wanted to compare our results with the data obtained by foreign colleagues. Of great importance in assessing cognitive function with the use of techniques that were standardized and had regulatory data for the Russian population, take into account gender and age. This approach made it possible to compare the results obtained with the data of foreign studies, which is important due to the limited number of works devoted to the cognitive functioning of patients with ovarian cancer. Third question: in our study in patients with ovarian cancer, depression was heterogeneous in nature, and both somatized and somatogenic depressions occurred, and regression analysis was performed, which showed the importance of clinical factors, in particular anemia, for the formation of somatogenic depression, and modeling by complex equations confirmed the significance of somatovegetative symptoms in the clinical picture, which is typical of somatized forms of depression. As Romashenko, for example, shows in the work Clinical Dynamic Characteristics of Somatized Depressive Disorders and Patients of a Therapeutic Hospital. Somatized depressions at the initial stage are characterized by the prevalence of the somatovegetative symptom complex. The results also correlate with other studies in the field of gynecological oncology. For example, the data presented in the dissertation of Samushya Marina Tipovna, which connects the heterogeneous nature of depression in gynecological cancer. Patients with polymorphism and psychogenic and somatogenical influences mediated by personality traits. I think that unintelligible solution is expressed in the work Depressions of Clinical Practice, and recognition of psychopathological disorders can be complicated by the fact that the clinical picture of depression can include somatization and comorbid somatoform disorders. Fourth question: the internal picture of the disease, a model of the representation of disease, is considered by modern researchers as an important intra-psychic construct, and that determines the emotional state, behavior, and quality of life for a person in collision with the disease. And this interpretation is based on the concept of Alexander Romanovich Luria. According to Professor Wasserman, the internal picture of the disease is a complex of affective cognitive response, and is involved in the regulation of mental activity and behavior of the patient. And sometimes this behavior is completely determined. The work made it the assumption that as a complex formation which includes a sensitive, emotional, intellectual, and strong-willed rational components, WKB is determined on the one hand by the personality of a person, and on the other hand, it is dynamic, largely depending on the patient's affective state. Since the construction of the structural equations demonstrated of mediating effect of anxiety and depression in cognitive function, it was suggested that the cause-effect relationship could be interpreted in this way. Examples of this interpretation can be also found in the work Irritable Bowel Syndrome, Clinical, Psychological, and Social Relationship by Baranowski, Wasserman, where it is indicated as psychopathological phenomenon, anxiety and depression. I understand that the author is satisfied. Anna Vladimirovna, are you satisfied with the answers? Anna Vladimirovna is satisfied with the answers. Thank you. Yes, that's what I understood as well. That's why that's for the procedure. I'm fully satisfied with the answers of Anna Sergeevna. With Mikhail Mikhailovich Reshetnikov, in terms of executive functions, in foreign studies, the concept of executive functions is used, most often translated into Russian as executive, as function of performing execution. The term has been used into Russian as been used for the past 15 to 20 years, but it has deep historical roots, including the work of Luria, who made the subject of his scientific research a study of the process of regulation of mental activity in terms of neuropsychology and the role of the frontal lobes of the brain. One of the first definitions of executive functions can be found in D.T. Strauss and D.F. Benson's frontal lobes, which reads as follows. Executive functions, significant abilities that most often refer to the frontal lobes, are activated in new situations that are not fixed in the experience, requiring original solutions. Currently, most authors describe executive functions as high-level processes whose task is to organize other basic processes. The list of processes related to executive functions varies among different authors. The most frequently mentioned are the following: setting goals, planning, anticipation, the ability to flexibly change cognitive attitudes, braking and pulse control, maintaining activity and suppressing the influence of interfering influences, error correction, allocating the attention processes. In our case, the Tower of London test was used to study executive functions. And so the next second question is about fertility and patient women. Cancer treatment, as a rule, negatively affects the sexual function and fertility of women. In young patients, it can lead to premature menopause, external changes, and loss of libido. Our analysis did not reveal significant relations between the absence of children and the emotional state of women. Most of the women surveyed, 80.5 had one or more children, which could lead to the absence of a significant effect of this factor on the development of mental disorders. In addition, at present, fertility can be maintained during chemotherapy, and organ-preserving surgeries can be performed for young patients. For example, in this study, such an operation was performed on a 19-year-old patient. The study showed that young women experience more pronounced discomfort due to the restriction of sexual activity. They have a high level of anxiety and depression. The data obtained are consistent with the results of other studies. For example, Norton et al. 2004 and Bodorka-Berbers et al. 2000, indicating that the younger the patient, the higher the level of distress she may experience. Studying the issue of maintaining fertility in different age groups of women suffering from ovarian cancer requires an independent study with different design. I'm totally satisfied, Mikhail. Thank you. So could you answer Dr. Big Heart's question? Yes, I understand. So what is the most important result of this study? This was the question. Yes, it would be interesting to. The most interesting result is mediating effect of affective disorders on the cognitive functions, because initially, when the hypotheses were first made, I thought that the share of chemotherapy would be higher, but when we looked at the patients, the neurotoxic effect, impacts would be higher on the cognitive functions, and this was not proved to be true, and this and the relation between cognitive and affective disorders in ovarian cancer patients is a promising avenue to develop. Dear Professor Bickert, are you satisfied with the question?
Yes, yes.
Do you are you satisfied with the
Oh yes, I did answer yes, completely satisfied.
Thank you very much. And please answer my questions now. Olga Yuryevna, your first question. Our data suggests that a decrease in cognitive function is significantly interconnected with maladaptive types of attitude towards the disease, and the patients with higher indicators of executive functions and attention differ in a harmonious attitude to the disease. High rates of working memory, motor skills, and attention are associated with the ergopathic attitude towards the disease. It can be concluded that intact cognitive function is associated with a harmonious, realistic, and balanced attitude to the disease. Such patients seek to promote treatment success. It was also found that cognitive impairment in patients with ovarian cancer is associated with ineffective regulation of affect and lead to increased hostility or aggression. Silchenko, Irina Vladimirovna, in her work, Aggressiveness and Hostility in this Etiopathogenesis of Psychosomatic Diseases of 2015, considered hostility and aggression as a risk factor, leading to a decrease in compliance and contributing to the adverse course of somatic diseases, including cancer. We were not able to find in addition data on the relationship of compliance and cognitive impairment in cancer patients. We couldn't find such works. And as far as the second question about the lack of of the interaction between cognitive dysfunction and chemotherapeutic treatment. In recent years, the influence of chemotherapy on cognitive functions has been recognized as ambiguous, in connection with which the initial term chemical brain was clarified, which was described by Heria et al. In 2007, and in a 2015 study, Lisa Hess says that cognitive function reduction was present only in 17% of patients with 6 months after the end of the chemotherapy, and for only one indicator, whatever, in ovarian cancer patients. The lack of a relationship between chemotherapy and the decrease in cognitive functioning has been identified in a number of studies on breast cancer patients. In 2010, Jean Dubes' longitudinal and population-based study based on neurophysiological diagnosis did not reveal a difference in the cognitive functioning of women with breast cancer after chemotherapy and in the control group of healthy women. In general, we can say that at present, the mechanism of cognitive impairment in cancer patients is unclear. This complex issue is still requires further study. In our study, no relation was found between the number, of course, of chemotherapy lines and cognitive decline. Chemotherapy is known to damage the DNA of cells and the tissues surrounding the tumor, but studies by Naden and al. 2006 suggest that oxidative DNA damage in patients with breast cancer occurs before chemotherapy, and that they can cause cognitive impairment. Allow me to gratefully accept your third point regarding clinical examples that could illustrate the results of the study. Unfortunately, the use of clinical examples could significantly increase the volume of dissertation research. We tried to present in detail the results of the clinical and psychological research of patients, focus on processing and interpretation of the material in order to maximize the disclosure of the coverage of the main research topic. Thank you very much for your critical remark. Anna Sergeevna, thank you very much for your answer to my questions and to the questions. And very good conceptually rich answers to all the questions of the dissertation members. Now I would like to read the questions that have been submitted. There have been following questions submitted. The following question. This is from Semyonova Marina Nikolaevna, candidate from Perm Polytechnic University. Dear Anna Sergeevna, can you see these questions? Can you see these questions? I can see these questions in the chat. Yeah, on page 12, the affective the most recurrence is depression, 18.3%. From what source do you derive this data? Can you show the main indicators of depression and anxiety? That's the first question. From Marina Nikolaevna. Where do you unify depression and anxiety into one percentage? Please, Anna Sergeevna. Please answer your questions. The question. What source I used for the data? This comes from the processing of the data. And we use two scales. The first screening hard scale, and then the iceberg scale, which that's 80. That's in point 3, and that's the depression that was after the expert examination of patients with the use of this scale. And the comorbidity results is based on the results of hospital scale. Why depression and anxiety in 1%? We will not we don't look at them as one condition, because we just look at it as one affective type of disorder, but they are treated they are treated separately in this study. And in terms of mechanisms of formation, all these relationships are described in detail in the dissertation. Thank you very much. Unfortunately, we cannot. How satisfied Marina Nikolaevna, the author of the question. Thank you very much. Also, we have a question from Violeta Maksudovna Habibovna, Master of Public Health, Master of Science in Social Work. Well, she's not employed at the moment. This was submitted before. It was submitted at 17 hours, 17 minutes, a methodology. In your presentation, my presentation that the requirements for the questions should be that their total relationship to the dissertation, and unfortunately the question that you formulated here is not entirely related to the dissertation, but nevertheless you determined that the dissertation is conducted in medical psychology field. I would like to you to qualify the boundaries of other related disciplines. Why not clinical psychology or psychiatry? Well, it's not related to the dissertation, but I would like to thank Violeta Maksudovna for the question, for the interest. But I will answer this question because this is I'm in charge of the management of this. Of course, clinical psychology and psychiatry are related areas, and of course these disorders that are the subject of this study are part of the study of these areas as well, but Anna Sergeevna Belozer is a psychologist by training, and the other areas are medical sciences, and Anna Sergeyevna would not be able to defend her dissertation in those areas. But I would just say that the dissertation presented to us is entirely psychological, not medical. We're training our students in clinical psychology, but the dissertations are defended in the degree field that's called medical psychology, and that's because of tradition. In international tradition, there's a term clinical psychology only. In the recent years, with the integration of Russian science into international science, uh, an agreement was reached to use clinical psychology, but both terms are still used interchangeably as synonymous terms. But the dissertation is defended only, can be defended, a dissertation can be defended only in the degree fields that are specified in the list of the High Attestation Committee of the Russian Federation. In this case, it is it's clinic medical psychology. And then this next question is, well, then the second question, what what were the cognitive and affective impairments in cancer, in ovarian cancer patients of the target group patient with ovarian cancer? What would be the subject and the object of study if it were conducted in clinical psychology or psychiatry? There's been another question. This is in the chat. Dear colleagues, another question in the chat. Yeah, this question was for Violeta. Well, there's some questions not according to the procedure. Regarding to the procedure of the dissertation, counsel, defense, I understand from the question there are two clinical websites. 98 patients were selected, and all of them gave consent to be part of the study, but there's no mention of the ethical committee's decision. Why only 82 patients? What? Two patients? Did you have any access to the medical histories of the patients? This is another question from Violeta Maksudna Habibovna. Please answer this. Answer again. Please answer this question. I'd like to answer these questions. This is an absolutely normal procedure of when a different number of patients are screened and randomized. As I said, we didn't get informed consent from each patient, and it was not part of the study initially. But every patient was examined. One examined was excluded based on her decision, and it was discussed with with the patient's doctor and the head of the department. Yes, and the access to medical histories and every patient for questions. I needed a consent from the doctor, the treating doctor, and the head of the department. So I had all the authorization. After studying medical history, I decided that some or through a clinical conversation that a patient didn't comply with my requirements. So this patient was not the work with this patient was discontinued. These were very heavy somatic patients, and all patients are in different conditions, and some of them were just not able to complete the whole battery of the whole battery of studies, and therefore I had to use a randomized approach. Since the questions are over, then we're giving the floor to the academic advisor, the chairperson, Anna Belozer, graduated from St. Petersburg University in psychology, and therefore it's very honored that the station is defended in her home university. Anna Sergeevna has done a lot of continuing education courses in the medical academy and medical university. I met Anna Sergeevna when she worked as a clinical psychologist in Pavlov neurosis clinic. I saw her professional competence and high training, a high level of training as a practicing clinical psychologist. And then Sergeyevna was very interested in research. The topic was chosen by her independently, entirely by her. As the our department staff do such research, and therefore we accepted her as a researcher. She was a brilliant postgraduate student. All exams were passed with excellent degrees, excellent grades. Well, she knows the literature very well because she speaks English so well, and she managed to organize a very dense research with patients with very heavy condition. So, and during the research period, she proved to be a very independent, initiative driven researcher. I hope that she will be able to develop her research in this field. Thank you, Natalia Nicola. Dear colleagues, I would like to make a step back and discuss with you that the questions of I said that these questions didn't have a direct relation to the content of the session, but I would like to hear your opinion. Was I right to rate her questions as slightly irrelevant? And so the question is again, you said that by not clinical or psychiatry, what do you think, dear colleagues? Is this question, can this question be recognized as relevant or irrelevant? I think it has no relation to the dissertation, to the content or the degree field. Everything is relevant. Everything is good. Anyone else would like to? I agree with Olga Yurina. Well, there was a continuation, but it followed. There was a follow-up. Anna Vladimirovna, do you agree? I agree with you. I think that this. I think it's not in the competence of under the jurisdiction of the dissertation author to identify the degree field. It's the higher station committee of the Russian Federation that defines the degree fields. Our colleague from the United States, the United States has its own classification of degrees. If you have any comments, dear Professor Bickert, then you can do that. No.
No comments.
Нет. Okay, thank you very much. Now, I would like to ask every member of the dissertation council, do you have any, or for Natalia Nikolaevna, the academic, any questions that haven't been answered, that or unclear issues with the distance mode of this session? No questions. And now my question is to the dissertation council members. Dear colleagues, we have an opportunity to announce a break to analyze the results, and the sound will be switching. Do we need such a break to deliberate on the verdict? I don't think we do. Well, we are only 2 hours and then we are already overboard. Any questions? No. Then we continue. Then we continue with the voting. Every member of the station council should be voiced. I put to the vote the resolution of awarding Anna Sergeyevna Belozerova a degree of candidate of psychological sciences in medical psychology. And I would like to ask all of you to voice your opinion, to vote. I remind you that the verdict is positive. If not less than 3 members of the station council vote in favor, according to the regulations. Please, Valentin Anatolievich Abakov, your opinion regarding the awarding of the degree to Anna Sergeyevna. As I said in my review, I'm in favor of the sought degree to Anna Sergeyevna. Thank you very much. Anna Vladimirovna, what is your opinion? I vote for, positively. Mikhail Mikhailovich, the qualification work is of high level. I support the decision. And Dr. Mark Hopkins, your opinion?
I strongly support.
Thank you very much. I also support the decision to award Anna Sergeyevna a degree of the candidate of psychological sciences. So therefore, counting the votes, therefore, dear colleagues, and all of those who are watching us online, I would like to declare that out of the 5 members of the station who took part in the voting procedure, 5 people voted in favor of the resolution, no nays, no abstentions. The decision to award Anna Sergeyevna Belozer a candidate of psychological sciences degree in the degree field in medical psychology is taken. Since our this session was online, do any members of the dissertation council or the defendant any questions or objections as per the procedure? Every member of the session should answer. No objections.
No objections.
Нет ответов. I have no objections. Dr. Bickert again, sorry.
I said no objections.
Okay. Thank you very much. Then the floor is given to the defendant, now candidate of sciences, for a concluding statement. I would like to thank of members of the dissertation council for this opportunity to present my research results, and thank for the profound questions and interested comments, and that I will use in my future publications and work. I would like to thank the support team for the professionalism and the detailed attitude to the preparation of this during the pandemic period, and which made it possible to have this defense. A great thank you to my alma mater, St. Petersburg University, where I studied, then did doctoral study, and now defend my dissertation. This is a great honor, and I hope that I've become a professional researcher, academic for the Natalia Nikolaevna, my academic advisor. Thank you very much for your time and your effort for all these years that allowed me to implement my goals, and also I'm thankful to all the clinical psychologists and clinical doctors, cancer doctors, and Petrov Center and Sokolov Hospital. Thank you, in St. Petersburg. Thank you very much. Dear colleagues, on behalf of everybody, I would like to congratulate sincerely Anna Sergeevna Belozer on the successful defense, and the broadcast should be switched off. Thank you very much.